Hey guys, welcome back and you're watching your medicine channel MMS, which makes medicine simple. Yes guys, medicine is fun if we make it simple. So once again we are continuing with our rheumatology series of lectures, and today we will talk about signs and symptoms of osteoarthritis, also known as degenerative joint disease. So primarily is two types, primary osteoarthritis and secondary osteoarthritis. Primary osteoarthritis is the disease of elderly patient, a disease of joint use, a biomechanical problem, a wear and tear problem, right? So here is the picture of one of my beautiful osteoarthritis patients. She came to my clinic, but she was crying with pain. I asked her, "What's your name, ma'am? Why you are crying so badly?" But since she was not in condition to tell about her name and anything, then she diagnosed with osteoarthritis, and also since she is 60 plus. So I called her, "Ma'am, you are osteo women. Ma'am, you are osteo women." So now let's begin with the signs and symptoms of osteoarthritis. Osteoarthritis can be non-inflammatory, inflammatory, septic, and hemorrhagic type, where osteoarthritis is a non-inflammatory type of arthritis. Though we can find WBC on joint aspiration of the patient, but this is not driven by the systemic inflammation, as we know already that this is a biomechanical, a wear and tear problem, a localized problem, right? Also, as we already know that osteoarthritis is an asymmetric non-inflammatory type of arthritis. Non-inflammatory means no cardinal signs of inflammation. Also no constitutional symptoms, because this is not a systemic disease and worse in evening as the day passes with activity. And patient will be there with normal levels of ESR and CRP. Whereas rheumatoid arthritis is a type of chronic autoimmune symmetric systemic type of arthritis, and patient will be there with the cardinal signs of inflammation like redness, swelling, pain, hotness, and disability, loss of function, which is worse in the morning and improve as the day passes with activity. Also, there will be elevated levels of ESR and CRP. So just to recap, that osteoarthritis is a biomechanical, non-inflammatory, asymmetric, degenerative joint disease of elderly, especially the females. Also, there will be no constitutional symptoms, because this is not a systemic disease which is worse in the evening as the day passes with use. Also, there will be normal levels of ESR and CRP and CBC. Also, as we already discussed in our previous lecture, that osteoarthritis is a non-inflammatory, biomechanical, degenerative joint disease in elderly, especially the females, in which all the structures of the joint have undergone pathological changes. And the pathological process of the disease is hyaline articular cartilage loss and present in a focal and initially non-uniform manner, which accompanied by increasing thickness and sclerosis of the subchondral bony plate by outgrowth of the osteophytes, the bony spurs at the joint margins, also stretching of the articular capsule, mild synovitis in many affected joints, and weakness of the muscles bridging the joints. Okay, so please take a note that osteoarthritis is the most common joint disease in elderly, especially females. Now let's talk about the risk factors for osteoarthritis. So these are intrinsic joint vulnerabilities that affect the local environment of the joint, such as previous damage, muscle weakness, increased bone density, malalignment, and proprioceptive deficiencies. Also the systemic factors that affecting the joint vulnerabilities, such as increased age, female gender, race and ethnicity, genetic susceptibility, and nutritional factors. So put together these two increase the susceptibility to develop osteoarthritis. Also, if patient is having obesity or some occupational injuries, then definitely this patient will develop osteoarthritis or its progression, right? So please take a note that the risk factors written in green, like previous damage, malalignment, obesity, and occupational injury, these are the modifiable risk factors for osteoarthritis, and especially the obesity, the number one and the major risk factor for osteoarthritis. So now let's talk about the signs and symptoms of osteoarthritis. As we already discussed in our previous lectures, that osteoarthritis can be monoarticular, oligoarticular, or in some rare cases polyarticular. So in most of the cases we found it monoarticular, but here we are talking about oligoarticular, which is involving 2 to 4 joints, because we are talking about the signs and symptoms of multiple joints, right? So the main symptoms are pain, which is exacerbated by the activity and relieved with rest. Also the joint stiffness, the morning stiffness, which is lasting for less than 30 minutes, though the pain predominates over the stiffness, and stiffness improve with the use, whereas pain worsen with use. Also the joint swelling, deformities, and joint instability. So the commonly involved joints in osteoarthritis are your hip, knee, lower lumbar, and PIP and DIP. Remember the Heberdian and Bouchard's note? Also, please take a note that wrist, elbow, and shoulder are generally spared. Okay, so the most commonly involved joint in osteoarthritis is your CMC1. This is somewhere here, and the less commonly involved is your MCP, right? So in early disease, the pain is episodic and triggered often by a day or two of the overactive use of a diseased joint. Also, as the disease progresses, the pain becomes continuous and even begins to bothersome at night. There will be no constitutional symptoms because this is not a systemic disease. Also, we can see in X-ray there will be increased bony prominences at the joint margins, also known as osteophytes, bony spurs, crepitus and grating sensation, also tenderness over the affected joint, reduced joint range of motion, and neurological signs if spine is involved, and lastly, muscle wasting, right? So this is all about the signs and symptoms of osteoarthritis. In our next lecture, we will talk about the pathophysiology, what causes osteoarthritis, right? So thank you so much for listening, and please do subscribe the channel to get all latest videos like this, and also help this beautiful osteoarthritis patient, osteo women, to reach and teach more and more patients like her about this nasty disease, osteoarthritis. Stay safe, study a lot. Thank you so much, guys.